Senate Bill 815. Imagine this. Imagine your doctor says you need a test or treatment, but your insurance company says no. You later find out that the decision may have been influenced by a computer system that flagged your case before a human ever looked at it. What the bill says it does? Senate Bill 815 says insurance companies cannot use artificial intelligence or automated systems to decide whether medical care is medically necessary. A human reviewer must make that decision. What it actually does? This means insurers must put a person in charge of denying care, not a computer. Doctors and patients gain leverage in disputes, while insurers lose the ability to rely on automated tools to issue denials. However, insurers can still use automation for administrative support and fraud detection, which may still influence outcomes behind the scenes. Who benefits? Patients who challenge coverage denials, doctors and hospitals dealing with utilization review, medical and patient advocacy organizations. Who pays the price? Insurance companies and third-party review vendors that use automation to cut costs. Patients if enforcement is weak and automation quietly remains part of the process. Why it matters. Healthcare decisions affect real lives, not spreadsheets. If a computer quietly shapes denials, people can lose care they needed without ever knowing why. Senate Bill 815 tries to put humans back in charge, but without clear penalties or transparency, everyday Texans may still be left guessing who really decided their fate. Questions to ask your lawmakers. How will regulators ensure insurers do not use automation to influence denials indirectly? Does the insurance department have enough staff and funding to enforce this law statewide? Why were disclosure requirements removed that would have told patients if AI was involved? Bottom line, Senate Bill 815 moves medical decisions back towards people, but without strong enforcement and transparency, it risks becoming a promise that patients cannot verify.